Hello, this is Dr. Albert. I'm a specialist in hematopathologist. It's the first time for me to see you all in the YouTube channel. I hope that through this channel, you can understand more about the medical and science knowledge, as well as my faith. Perhaps you are not familiar with the term hematopathologist. In fact, what is the job nature of the hematopathologist? When will you meet the hematopathologist in hospital? Today I'm going to introduce you about the job of hematopathologist. There are 6 main disciplines under the Department of Pathology, including the anatomical pathology, chemical pathology, microbiology, hematology, immunology, as well as forensic pathology. Perhaps you may not know around, let's say, 70 to 80% of the disease had to be diagnosed by the pathologist. Many diseases have to be diagnosed with the use of the modern laboratory equipment. After the laboratory tests, we have to decide on the treatment plan and how to classify the patient into high risk and low risk by the result of the laboratory tests. Therefore, pathologists are the well-known discipline which we often say is doctors. So when patients who are suspected to having the blood-related or lymph node-related disease will be referred to see the clinical hematologist, and they will analyze patient's history, and they will perform the physical examination on the patient, and then they will decide the appropriate laboratory test, including the blood tests and also the bone marrow examination. And the blood will be sent to the hematology lab, and in the hematology lab, the technicians will prepare the blood or bone marrow smear. So the pathologist can examine the smear under the microscope for making the diagnosis, as well as they will decide what kind of laboratory test is needed for the patient, and therefore to decide on the treatment plan for the patient. And the result of the laboratory test is very important because the result have implications on the use of the medications, whether the patient will benefit from the targeted therapy, or they will consider of bone marrow transplant if it is a blood cancer, or we call the acute leukemia. Let me provide an example to you. For acute leukemia, there are many different types of the acute leukemia, and the classification is very complicated. However, the treatment plan for each type of the leukemia is totally different. Also, not all blood cancer patients need to be undergo the bone marrow transplant, because the bone marrow transplant is a high-risk procedure which will cause a relative high mortality as well as the long-term morbidity. And therefore, this procedure needs to be reserved for the patient with high relapse rate. Nowadays, we will do further genetic study or DNA tests for the patients with the hematological cancer. The hematologist will analyze the results of the genetic study, and they will analyze the result to further assess the chance of the relapse of the patient. And so they can decide whether the patient need for bone marrow transplant or not, or decide the further treatment plan. So, when will the patient see the hematopathologist? In fact, hematopathologists perform like a detective behind the scene, and they work for the patients silently. In Hong Kong, in order to be the hematopathologist, you have to complete medical studies in university and then complete 1 year the internship program in the public hospital. Then you could choose one of the main disciplines of the pathology for in-hospital training. It's nearly 1-to-1 training to the new doctor who entered the discipline of the pathology, and you need to attend to examinations during training. Among all the specialty of the medicine, hematopathologist is one of the subjects have the highest failure rate, and the examination is very difficult. As you know, all the medical diagnosis and the laboratory result is to be very accurate, and the analysis is very critical, so they can never accept any mistakes. Okay. As such, the standard of the professional performance of the hematopathologist is expected to be very high. In general, it took around 6 years to complete the training. However, some of our colleagues may not be so lucky, and they may need to retake the examination, and the time of training may be longer. It's also a difficult time for me to study during the period of the training. I studied very hard to complete training. At the time of training, I have to study until midnight after work. It's very tired. But fortunately, I felt being supported by my family members. Besides, God has accompanied me and led me during the process, so that now I could be a qualified hematopathologist. Next time, I will talk about blood cells under the microscope. If you like my videos, please like, share, and subscribe my channel. Thank you.